Good morning. My name is Thelma Jackson, and I'm Director of Programs and also Community Action Network Coordinator, better known as the CAN. We at Healthy Start and CAN are simply delighted to have you join us today in our legislative breakfast. We welcome you to our fourth annual legislative breakfast on behalf of Black Moms Matter platform. Today, our topic will focus on the social determinants of health for Black families. So we have invited legislators, we've invited professionals, and we have provided medical individuals to discuss this subject at length. So it is our hope that you will glean important information to share with your community. Again, I say thank you for joining us this morning. And now, I would like to introduce Jada Sherrill, our CEO of Healthy Start, who will have the privilege, of introducing our next guest speaker for the day. Go, Jada.
I need to unmute. Thank you, Thelma. Good morning, everyone. Good morning to our Healthy Start family, staff, our Community Action Network. Thank you for putting together this wonderful opportunity to learn about the social determinants of health and to talk about how we all can be engaged in advocacy and legislation and how important it is to all of our daily lives. I'm really excited for the slate of speakers and testimonials that will be shared at this morning's legislative breakfast. And I'm honored that you all have taken the time to spend this day with us or this time with us to learn more about what Healthy Start is doing, but also more broadly, how important it is to center Black moms and babies in this work of health equity and exploring social determinants of health. I am excited to introduce one of our guest speakers this morning, our Chief Executive of Allegheny County, Sarah Innamorato. Sarah Innamorato was sworn in as Allegheny County Chief Executive on January 2nd, 2024. Prior to winning the election for county executive, she served in the Pennsylvania House of Representatives after securing an overwhelming majority and winning the election for the 21st District seat in 2018. Representative Sarah Innamorato served as Vice Chair of the Allegheny County Delegation and as a member of committees for the House of Finance, Labor and Industry, Transportation, Health, and Housing and Community Development. Sarah is a founding member of the Welcoming PA Caucus and the Pittsburgh Citywide Task Force on Employee Ownership, and served as Treasurer of the Urban Redevelopment Authority and Vice Chair of the Allegheny County Housing Authority. And I think it's no secret, Sarah has been an advocate and ally to both Healthy Start and women's reproductive rights movements across the country, focusing on childcare, focusing on equal pay, many of those things that you will learn about in her platform as she continues to roll that out as our esteemed county executive. As state representative, Sarah introduced dozens of bills, leading the effort to increase the supply of affordable housing, raise the minimum wage, secure environmental protections, compassionately address the opioid epidemic, establish the first office of New Pennsylvanians, create a working families tax credit, and protect reproductive health care. In 2022, the legislature passed Sarah's Whole Home Repairs legislation, which distributed $125 million in critical funding to keep seniors and those facing housing insecurity in their homes while investing in climate resilience and local workforce development. Sarah is a lifelong resident of Allegheny County, currently residing in Upper Lawrenceville. She's a graduate of North Hills High School and graduated from the University of Pittsburgh's College of Business Administration. Again, we are so excited to hear from Sarah this morning. Sarah, thank you for taking the time to be with us and share with us. And without further ado, I would like to welcome you onto this platform.
Great. Thank you so much, Jada, for that very warm welcome. It's so wonderful to be with you all today in virtual community. I'm new to the role of county executive, but I'm not new to being a part of this panel. And I just Jada, appreciate you and your team and the work that you do at Healthy Start. It is incredible, from everything from, new initiatives like the Centering Pregnancy to reduce racial disparities and birth outcomes and outcomes for new moms and babies, to home visits, to supporting the Black Doula Network, to making sure that dads have the supports that they need. The work that you do is vast, and it's so incredibly necessary for our community, and just value and appreciate the work that you and your team does each and every day. So thank you, thank you. So I'm honored to be here with you all. I say that as your county executive, I'm honored, but I'm also, in a constant state of joy despite all the challenges, because this is an opportunity to use this position to really help make the world a better place, starting right here in Allegheny County. And my mandate is simple as your county executive. It's to build an Allegheny County for us all. And that means different things to different people. And it cannot be defined unless you have the community voice at the table. So I want to start my address on the state of the county by talking a little bit about what our transition has looked like, because I'm only a few weeks on the job. So I still have a lot to learn. We still have a lot of work to do, but we've set up structures that engage people with county government, often for the first time, and bring them to the table. So the day of my inauguration on January 2nd, we launched the All in Allegheny initiative. Jada is a person who has been an incredible asset to our transition team and that work, and making sure that maternal and infant health, especially in the Black community, is elevated as a priority as it pertains to the future, the present and the future of this administration. So we worked with that committee to design a survey. We launched it in all corners of the county, and we got more than 19,000 responses from the community. So right now we're going over about 700,000 data points to really inform the work that my administration does moving forward. So we've been really busy with that and doing our community engagement around those efforts. We've really been focusing on promoting community voices through that initiative, but also talking about who is serving on our boards and authorities and commissions, and do they look like the county? So we've been making a concerted effort to increase the diversity of the people who are serving on these very critical and powerful boards. We've raised the wages for county workers our first day in office to $18 an hour, and increased vacation time, because we know our public sector workers work hard each and every day to make sure that the residents of this county have what they deserve. And we need to make sure that we're caring for our people at the county. We're expanding voter access by adding more drop-off locations for this primary election, and hope to expand them into the future for the general. We launched the Allegheny County Financial Empowerment Center. We invested in the Allegheny County Child Care Matters program by adding $500,000 and clearing the wait list. And that really helps working families that are between 200 and 300% the federal poverty line. So it's really our lower wage workers and families who need the support. And we saw a need, and we redirected dollars towards it. And then we've been focusing heavily on ensuring safe, stable, and affordable housing. We'll have more announcements around that soon, but we are hiring a director of housing to work in the executive's office, to work across departments, so that we can deliver on that promise. And that's just, the first 2 months of the administration. And so we've been very busy, but we know that there is so much more work to do. Today's conversation is about the social determinants of health, and that encompasses such critical factors that include food security, housing conditions, childcare accessibility, equitable healthcare, and reliable transportation systems. And all of these are responsibilities of the county government. These elements, they profoundly shape the well-being of our residents, influence both the physical and mental health outcomes within our daily lives. And we want all Allegheny County residents to lead healthy lives as demonstrated by their physical and behavioral health and the environments in which they live, they learn, they work, and they play. Over the next 3 years, our Allegheny County Health Department is committed to implementing equity-driven, community-engaged, data-supported, and policy-supported initiatives to further these goals. We're here today to specifically confront a pressing issue that affects the core of our community, the maternal health disparities that exist, particularly within communities of color and the Black community. I'm so honored to stand here with all of you, well, to virtually be here with all of you, and with such esteemed leaders and advocates as we delve into this topic today and really unpack it and discuss new initiatives aimed at improving care for mothers, for birthing people, and for their babies, especially with Black women. The statistics paint a stark reality that demands our immediate attention. In Allegheny County and across the state, we have witnessed a troubling rise in pregnancy-associated deaths. Shockingly, there are 82 deaths per 100,000 live births in Pennsylvania, highlighting a profound and urgent need for action. And we know that not every community shares these burdens equitably. Black babies in Allegheny County die before the age of 1 at a rate of over 5 times that of white babies. And that is unacceptable. And not only do we have the data, but we have the stories from mothers, from families on how devastating this is to our community. And when we have a community that is hurting in this way, it hurts us all. So it is extremely urgent that we take this up and that we move it into action. Because these disparities, they're unacceptable, and they compel us to take decisive and comprehensive action. And our goal is crystal clear, right? It's to ensure that every mother and baby receives high quality care they deserve, regardless of their race or ethnicity or their income level. Achieving this goal is going to require a multifaceted approach. That's why we're talking not only about our investments in public health, but our investments in all the social determinants of health that feed into the whole person and of individuals, of babies, and a family and a community's ability to thrive. This is why we will be working in the short term to invest in WIC and make sure that we are reversing the declines in the program's enrollment and really increase the awareness and make sure that we're removing any barriers for families to be able to access that program. Like I mentioned, housing is going to be a critical component of this administration. That is why we passed the whole home repair program at the state level, and we're administering it at the county, because it's not just about energy efficiency and adaptability for older adults and reducing energy burden, which impacts families' wallets, but it's also about the health and safety of kids. When we're talking about our housing stock, we know that there is lead and other health hazards that exist. And so we need monies to be able to ensure that everyone not only has a safe and affordable home, but that home is healthy. We have, we'll be bringing on a director of housing soon. So we'll be focusing on creating more affordable housing options for our communities. Like I mentioned, transportation, it's critical in this ecosystem that is addressing maternal health and making sure that everyone has the opportunity to thrive. That's why we will be expanding the half fare pilot, and we will be offering half fares through our to SNAP recipients through Pittsburgh Regional Transit, and that program is slated to launch later this year. We're also focusing on continuing to increase access to childcare. Like I mentioned, the first 2 weeks in office, we put an additional $500,000 towards our Allegheny County Childcare Matters program. We will continue to invest in childcare options for our low income and working class families. In my administration, we are wholeheartedly in support and promote Allegheny County's birth plan for Black babies and families, which focuses on battling inequities and realizing transformative health outcomes. So that's just a little bit about what you can expect from my administration and where I'm going to be out in the community asking for your support and your health and your voice on how we can make those programs the most effective and reach the most amount of people in the way that they need to reach people and families. It's going to take so much more to achieve equity and to close racial disparities as it pertains to health outcomes in Allegheny County. We're going to need substantive policy change. We're going to need to support organizations like Healthy Start in the work that they do each and every day because they know the community best. And we're going to need to support anti-racist training in our government and healthcare systems so that we can recognize our biases and work towards dismantling them so everyone has the same experience and has one that's catered to their specific needs. And today's dialogue, it's not just about talking about the problem, it's about celebrating the wins that we've had, but it's also about creating a call to action. In my administration, in our community organizations, with our state representatives and state senators that we have here today, together, I know that we are going to work together to build a healthier, a more diverse, a more inclusive, a more equitable Allegheny County for mothers, for babies, for birthing people here in our region, but throughout the Commonwealth and beyond. And I'm so grateful to be here with you today. Thank you for having me. Thank you for allowing me to address you today. And thank you for your voice in helping us build an Allegheny County for us all.
Thank you so much, Sarah. Thank you for your impactful words. Thank you for your leadership. And thank you for making that connection around your plans and how you are working directly to acknowledge the disparities that are faced in the Black community, but also how that impacts everyone and how when we as a community address these disparities, everyone will have better quality of life. At this point, I would like to turn it over to Goddess Dupreen, who is a part of our Healthy Start family, among many other things. She is a community health advocate. She is on many of our committees, many of our research projects. And I would just like to thank you, Dupreen, for always extending yourself to help support the Healthy Start mission and our programs and our network. Dupreen?
Grand Risings, beautiful people. Thank you for having me. At this time, I would like to introduce Danae Wilson. Danae Wilson is the Deputy Director of Community and Family Health at Allegheny County Health Department. In her role, she oversees community prevention programs such as violence prevention, family child health, women, infant, and children, known as WIC, and also chronic disease and injury prevention. She has been with the health department since 2010. Danae has more than 27 years of experience in maternal and child health, starting as an outreach worker for Healthy Start in 1997. She previously served on the Governor's Maternal Review Committee and is currently serving on the board of directors of City Match, a national maternal and child health organization. Locally, Danae serves on the board of directors of Healthy Start Incorporated, also DHS, CYF Advisory Board, Footbridge for Families, Black Women's Policy Agenda, and Southwest Area Health Education Center, known as AHEC. She also dedicates her time to other advisory committees, such at the state and local level, including pregnancy risk assessment monitoring systems, PRAMS. Women's Health Activist Movement Global, known as WHAM Global. The Pittsburgh Study Infant and Toddler Cohort. University of Pittsburgh Office of Child Development, and Black Environmental Collective. She is a Carlow University alumni. She received a bachelor's degree in communications and a master's degree in organizational leadership. At this time, let's welcome Ms. Danae Wilson.
Good morning, everyone. I want to thank you for Healthy Start and the CAN for inviting me this morning. I'm always excited to be connected to Healthy Start. So yes, thank you for listening to my bio. But I think what the bio didn't say is that I actually grew up in the Hill District, that I actually was a participant of the Healthy Start program, and that my whole life has been dedicated to families in Allegheny County, particularly Black families. And some of that work, as I think about it, last night, as I got teary-eyed, when I showed up to a board meeting last night at Healthy Start and saw my child, my daughter that I gave birth to in 1995, working for Healthy Start, leading the next charge of the next generation. So when we talk about social determinants of health for Black families, I do agree with our county executive that it is to be celebrated. We are not a problem. We are the solution. And it's up to each and every one of us, right, to think about what are the ways that we can make change. Second generation teen pregnant mom, but my daughter didn't follow that. And it is us who are on this call today to think about what are the ways that we make changes for our next generation. How do we improve the outcomes and change some of the generational challenges that we faced before? Well, you have to look no further than yourself. And hopefully this presentation today, which I'm bringing to you, is really about what is the health department and what is our involvement in helping to solve this complex challenge of social determinants of health, which individuals, regardless of race, gender, income, have anything in terms of developing these social determinants. It's a lot bigger than each individual person, but it's going to take a collective of all of us to solve it. So please, I hope this, next 15 or 17 minutes that I have with you, that you take one thing away and that you remember that you are valued, you are appreciated, and that there are many, many programs and services at play to help support you on your journey to changing outcomes for you and your families. So really, what I wanted to do with this talk is to really think about the social determinants of health through a lens that we have worked on in community over the last several years, which is our ACHD Plan for a Healthy Allegheny, which includes community input. And then I want to talk a little bit about the work that my bureau is doing to support the social determinants of health. So when we talk about social determinants of health, our county executive brought some of these up already, but when we think about it, it's really about all of the things that can change the situation where you live and how you work, or how those things actually impact your life and your health. And so we think about that in terms of how much money you make at work. We think about that in terms of which community you live in. We think about that in terms of what is the environment in which you live, in terms of housing stock. We know that a lot of houses in Allegheny County were built before 1970, and therefore there may be some lead into housing stock, right? We know that health and healthcare is not just about accessing it, how do you get there by car, but it's about how are you able to communicate with your provider, and is that communication respectful, and do they understand and hear the concerns that you have, right? When we think about access, it's a lot broader than transportation. And so it's important to also think about education, right? Our educational system, how does it prepare people and young people, particularly throughout our region, to be able to be prepared for the work that is ahead of us. So I'm going to talk a little bit about the Plan for a Healthy Allegheny, which takes us from 2023 to 2027.
And before I even get started, the Allegheny County Health Department has about 350 plus employees. So we recognize that this plan, it doesn't belong to the health department. It belongs to every one of you on this call. And so how do we get it done? How do we accomplish the things in this plan? It's going to require all of us to be engaged. So we do take community engagement very seriously. And I think our county exec shown in her first 2 months in office how important community engagement is to her as well. And that is demonstrated through the number of events, the surveys, all of the work that is going on. And that's no different from what we do in public health, right? It's how do we understand what the community is facing so that we design interventions to address those. So we did that twice because for many of you on this call, we've all lived through the pandemic, COVID, on the beginning or before, I should say, because we don't know what year it is anymore. It's kind of either you talk in terms of before COVID and after. But 2019, we did a survey of residents and found that the top priorities at that time included substance use, distracted driving, healthy eating, physical activity, and racism. We conducted that same survey post-COVID and changed the questions just a little, given what we understood about how COVID impacted communities in Allegheny County. But the responses, as you can note from this slide, that racism rose to the top. So this is something that our residents are struggling with for sure. And so we also did the listening sessions, again, thinking about how do we understand what residents are saying, which communities are impacted, and allowing us to really think about how we think and use this information to design programs and services in Allegheny County. So what we wanted to do was think about where do we start? So you have to have a baseline. And then we were thinking about where do we go? How do we think about these items in a way that prioritizes 3 areas of focus, which the county exec mentioned before: physical health, behavioral health, and environmental health. The way that we do that, or we thought or broke out these goals, was we had to use an equity lens, understanding who is impacted most by the decisions that we make, and also prioritizing those populations in our goals and in our work. We also want to continue to remain community engaged. We want to continue to have these conversations, not just in 2019 and 2021, but ongoing over the next 4 years. So we're remaining current on how those experiences and how the changes in the plans that we've made have made an impact. And if not, what other ways can we drive those solutions? In all the things that we do, we focus on what does the data tell us? Data for us is not just the statistical data, which we have a lot of, but it's also the stories. And so oftentimes it feels like your stories, you keep repeating yourself, but we hear them, we document them, and we use them to help inform. And the last is policy informed. As you know, at the Allegheny County Health Department, the majority of our work is really around regulatory topics or regulatory arms. That's our job. Our main job is to make sure that things like housing are safe for individuals living in our community, to make sure air quality is safe for individuals living in our community. But then we have a small fraction of our work that's based on intervention. And I'll talk a little bit about those today. And this is our overall goal with the Plan for a Healthy Allegheny, that residents lead healthy lives in the communities that they live, physically, behaviorally, and that the environment provides the resources that you can use to be able to live a healthy life. So this is a big plan. It has a lot of parts. Lots of them are moving at all times. And I know sometimes it can seem frustrating when you feel like things are not happening or you don't see those things working in your favor at that particular time. Please note that this is a big plan and we are working with many community partners, in fact, hundreds, to try to find solutions and not do them ourselves. Again, it's find and partner with those organizations that are usually working with community members directly. What are in our physical health goals? we want to focus on that people of all ages engage in behaviors that promote physical health and reduce the risk of chronic disease. I didn't want to make this a data-heavy presentation, but what I can tell you about chronic disease is it's the leading cause of death for residents in our region. And there are some behaviors that we can change that will help us to prevent chronic disease of ourselves and of our family members. All people have appropriate places to obtain medical and dental care, right? It's where are you going? Is it the right place for you? Do we have enough options for you to be able to access those locations and get the quality care that you need and deserve? Decreased disparities in life expectancy and chronic disease. Again, understanding what the data is telling us and focusing on how do we decrease those over time. Behavioral health. The health department directly has very little resources or programming around behavioral health, but overwhelmingly, we receive lots of qualitative stories from families about the need for more behavioral health services. And so we're partnering very closely with our partners over at the Department of Human Services to identify solutions for how we can better serve the populations of all ages. Before our previous director, Dr. Bogan, left, one of her legacy items was to help support school districts in Allegheny County to increase their behavioral health services. So we are involved, but very limited, again, partnering with other organizations or entities in our community to get the work done. Substance abuse has crippled our community. It has affected so many of our families and communities, particularly a historical component for Black families. And we're still recovering from those particular issues today. And so how do we think about the work that we're doing? We have a large population of families that are still trying to figure that out. And so we are here at the health department working on OUD and other disorders to help families cope. And again, that work is done with partners like Healthy Start or other organizations in community. And then the other is people will participate in programs and activities that support their mental health and well-being. Well, that could be a number of things. It can mean go out and exercise, or making sure that there's more walkability in your neighborhood, that there's a park with green grass so that you can go and sit and reflect. And so a lot of our work is really centered around what are the things we can do infrastructurally and also program-based that can help improve those conditions for families and community. Environmental health goals. More people live in stable and safe housing. Our housing program just made a huge change to Article 6, which you can find on our website, and understand what do those regulations mean to getting our housing stock up to code so that it's safer for residents to live. Fewer people experience violence in their homes and communities. We understand the impact of violence, and it's just not gun violence on the streets, but it's also violence in your home, right? It's violence in between your partner. It's violence between different family members or community members. We know that violence is much broader than what is announced, publicly on TV. We see that gun violence is very easy to recognize. But what's kind of underlying those things is also the personal violence that people share in private. And so we're also thinking about those things and how do we mitigate or address those concerns. And then the last, which is very important to a lot of our residents, and we continue to understand what are some solutions and priorities in that area, and also have to think forward, right? We have air quality, but then we also have to think about climate change, which are really complex issues. And so we want to make sure that we're thinking about how do we support the 130 municipalities in Allegheny County to solve some of the challenges that we're going to face in the future and the things of the present. So I just want to give you an example of what that looks like. In our chronic disease section, we want more children, teens, and adults to have healthy eating behaviors. What does that mean and what does that look like? Well, one of the ways is that we want to include and increase the number of WIC-approved grocery stores throughout our region. We know that large stores are important, but we also know that there's that corner store in your neighborhood. How can we help them to make sure that they also have those WIC approved items that you need in a pinch, and you can walk there and purchase those items. So we will be committing in the next 2 years to increase the number of small stores by helping support them. The number one challenge for small stores is the startup costs. So we'll be helping to support them by ensuring they get the startup costs to be able to become a WIC authorized location. More children, teens, and adults are physically active. If you don't remember, we have our Live Well Allegheny campaign. This was a large initiative under our previous director, Dr. Karen Hacker, and the county executive, Rich Fitzgerald, that we continue, and it uses a health and all policies framework. An example of that would be smoke-free playgrounds within municipalities. That's something that helps everyone, including our Black families. If they can go and take their children to the park and not have to worry about secondhand smoke exposure, that is a way that we're solving something for the broader population, which is our work in public health. Infant and maternal health. I cannot remove this from our conversation, even though I wasn't asked to talk about it directly, which is my love and my passion is moms and babies. How can we make a change from this perspective? We definitely understood during the pandemic when there was no formula available for many families. They couldn't find it on the shelves. But what we know is that if we think about it from a population perspective, that breastfeeding, if you're able, is the number one best way to feed your baby, right? If you can. But we also have resources like the Greater Pittsburgh Food Formula. I can't talk today. I'm sorry, you all. The Three Rivers Milk Bank, which also provides breast milk to our smallest, most fragile babies. And so how do we ensure that if we ever incur a situation like we did before, that we have the resources to help families who are having access issues with formula to re-lactate? I didn't know this term until the pandemic came upon us. So we want to increase the number of trained professionals that can help families not only start breastfeeding, but continue to breastfeed for as long as they are able and willing. The other kind of thing that we want to focus on in infant and maternal mortality is to reduce the racial disparity. But as our executive said, it's happened and been happening for decades. It's going to take us some really strong, committed decisions to really change what we see. We too support the birth plan for Black babies and families that Healthy Start is leading. In any of our work that we are doing, we have committed to providing that data so that we can see what is happening across the county to ensure that we're making a difference with those racial disparities. So just my last 5 minutes or so, I want to talk about our community and family health and replay and understand how we apply the social determinants to drive our interventions, policies, and practice internally. So we already talked about what's in my bureau. We have chronic disease, family and child health, violence, traffic safety, and injury prevention. If you think about how all of these intersect, it's really our whole entire lifespan. So our bureau really has an impact on individuals from birth to end of life. So to think about how do we integrate that work so that we think about social determinants of health from the time someone's born to the time that they die? How do we think about the things that impact community members collectively, and particularly those that are impacted the most in terms of racial disparities? So under physical health, I just want to show you some of the work that we're doing from each of these larger contexts, including our chronic disease section, family child health, and violence prevention. We have a number of programs to engage and address some of the challenges that we face. We talked about WIC, we talked about home visiting, we talked about fatherhood. We also talk about changing the behaviors, right? Rethink Your Drink is a large campaign we launched 2 years ago to think about, instead of those sugary beverages, choose water, right? Get you a Stanley cup, which everybody was a craze, or get you some type of cup that allows you to measure and monitor your water intake, right? That we have safe and healthy communities programs that help to address the needs of residents around those very topics. We have a dating matters program for teens in high schools across the region. And a new grant that we have is really focusing on Alzheimer's and dementia-related diseases. And we're really excited about that opportunity because we do need to think about how do people live long-term in our region. From a behavioral health perspective and home visiting and other programs, we do assess families for the number of ranges of depression, IPV, or substance use, and help and assist with referring them to programs that can assist. But we also think about going forward from a policy perspective by looking at our child death review that requires us to look at every death in Allegheny County from 0 to 21. And we look at those deaths not to think about it in a way that allows us to make recommendations about what are ways in which different institutions, programs, or services can change what they do in order to make an impact so we don't see or lose another child. We also recently, in collaboration with Healthy Start and the University of Pittsburgh Children's Hospital, excuse me, not University of Pittsburgh, UPMC Children's Hospital, started a fetal infant mortality review. Again, reviewing those losses so that we understand both from the parent and from the medical record, what are the best ways that we can really change the outcomes. We've learned a lot. We learned that we really don't know about fetal movement. And so you'll see some work coming out of the community action team in the next couple months over really understanding what does that mean if you don't know that your baby has moved, or you didn't understand, or you're not getting the appropriate prenatal care or the right type of provider. All those things are going to be important recommendations and actions that you'll see come out of that work. And then violence prevention is interrupting and thinking about violence before it gets started. Our youth are so important. And so how do we make sure, as I indicated before, about behavioral health services in schools, and that young people have a place to go to talk about the challenges that they face? And then I just briefly want to go through some of the, in terms of the different social determinants of health, how we address those in our programs. And so for economic stability, I want to talk about WIC. And particularly, WIC is a program that helps to support nutrition needs for families. And I really think that's an important initiative. And I heard the executive earlier talk about declining enrollment. And one thing that I talked about, and I'm sharing a personal story about my own daughter, and I work for the health department, she didn't know that she could have a proxy. And so how do we as a health department think about the ways in which, like, you know, people will say, I can't get to my WIC appointments, but you don't have to. You can assign up to 3 individuals to help support you to go and get your WIC benefit. And so there's lots of ways in which there are ways, the opportunities to get on WIC and to not have to do it yourself, but times that you have to show up physically or your baby. But we want to make sure that people know that. And there's home visiting programs, there's other programs that potentially, if you don't have a support person, your home visiting person can be your proxy and go and get your benefits because they're coming to your home anyway. And so how do we help families navigate a complex challenge and let them know that there's ways that we can help them get around it? Partnership collaborations with local agencies, state and local providers to ensure that we know that we can't do it ourselves, that we partner with the right agencies at the right time. And then we talked about funding also in terms of economic stability. It's the government's role to also help fund. And so the Clean Air Fund is one example where communities can access financial resources to improve the air quality. Housing in neighborhoods, we talked about our housing program and their regulatory responsibilities. We know that the housing program inspects homes. They help to think about what do we do to reduce lead exposure. So they're trying to find and identify if lead exposure is impacting your family or your children. We have our violence prevention programs that are looking at the ways in which we reduce violence in communities. And then we have our CDC Racial and Ethnic Approaches to Community Health REACH grant that really thinks about physical activity, nutrition, and breastfeeding, right? And I talked earlier about physical activity can mean something like increasing walkability. From an education perspective, we do a lot of education in communities and increasing awareness. We have a dental sealant program that's been in existence for I don't know, several decades. And that program helps to ensure that young people have strong teeth and they're able to keep free from cavities and other harmful illnesses related to your teeth. We have behavioral health services in the schools we talked about, and we talk about that often. We have traffic safety programs in many schools to help prepare young people and also to think about their driving as a responsibility. Asthma programs, because we know that asthma impacts a large number of our communities. And then we already talked about violence prevention education. And then if you're ever in need of data for whether you're writing a grant or you just want to know more about a problem or you want to take it to your legislator, we also talked about advocacy. One of our major roles is to provide that data to you, and you can find that on our website. We have a data dashboard, and we also have published data briefs that we put up there rather frequently. Social and community connections in terms of social determinants. We have a number of collaborations in community. All of these, I'm not going to read them all, are collaborations that we have with a number of organizations. Before in preparing for this particular talk, we have over 500 community organizations that we partner with, and many in different ways. And one of the challenges we learned is that we don't know from one program to the next if we're partnering with the same organization or not. And so that's our challenge that we need to address and make sure that we're connecting the dots and making sure that organizations know the other work that we're doing and we're not continuing to silo. So food and nutrition, which again is so important. We talked about the WIC program, and we received a number of several support of dollars funding from our local foundations to help us, particularly with our WIC mobile van. You may have seen this in community. It's been at events. We plan to start actually accepting participants on our van here in the summer, spring, in the next couple months. And also we've increased the number of clinics that we have. We have 2 clinics at UPMC McGee and the Pediatric GAP program in Oakland. So you can also visit your WIC appointments while you're already doing other business in Oakland and or at your doctor's appointments. Our home visiting programs go to your home. It's confidential. No one has to know you're in the program, but it also our program provides registered nurses. And so you're also getting a medical professional that can help you to think about your conversations with your medical provider going forward. And then lastly, we really understood that, again, breastfeeding is really important to us here, that we have called all of our nurses, our lactation counselors, and we have 2 IBCLCs on staff, but from 8:30 to 4:30 is not enough for our residents. Usually those challenges happen in the evening or even overnight. And so we partner with Pacify Health to deliver 24-hour telehealth lactation service to residents who might be interested. Right now, we're piloting that with our home visiting and WIC families, but we hope to understand that that is a great resource and offer it to everyone who is interested in Allegheny County. We talked about transportation. What we do to address transportation in many of our programs is offer families assistance to get to and from us if you must. And so we have various resources to do that, whether it's cab, rideshare service, or even helping you to navigate Pittsburgh Regional Transit. And then most importantly, since COVID, we learned that we can offer virtual options for engagement, like Healthy Start has done amazing at. And so when I leave here, I want to leave you with some thoughts or some conclusions to think about your work going forward. What are some considerations or questions you can ask of yourself to help you on your journey? And the data doesn't mean go to our website. The data can just mean thinking about your family history. What are the ways in which you've grown up, that you've lived, that you know can be harmful to your own health? And how can you start making those small changes, simple as changing from sugary drinks, to encourage well-being? We have Taylor Clem on the call, who I know is fantastic. Wellness, I mean, if you ever want to know how to eat, the term is nutrition, medicine, food is medicine, talk to Taylor Clem. I really encourage us to think about the things that we put into our bodies that have such a detrimental impact over time. Fried food might seem like no big deal at 15, but at 50, it's a big deal. And so how do we think about eating well throughout our lifespan and not thinking, oh, because I'm young, it's okay. What we do today impacts tomorrow. And how do you start changing your life? But I want to leave you with one opportunity or two. One is we are hiring at Allegheny County. Our executive is so humble, but I appreciate that this is a great place to work. As we talked about earlier, I've been here since 2010. If you really want to be a part of the solution, I think considering working for the county is one of the ways in which you can choose to do so. We offer a lot of good benefits that you can have, but most importantly, as residents of Allegheny County, you'll be engaged in helping your other neighbors. And I think that's the greatest thing that I've appreciated over the years of working here, that I know I'm making an impact, not just for my own family, but for the neighbors in which I live around. And for us, those of you who are in the maternal and child health space or interested in maternal and child health, every 5 years, the State Department of Health puts out this Title V needs assessment. And right now is the time to get your voice heard. If you don't like what's happening in maternal child health, you think we should be focusing on mental health, you think we should be focusing on infants, you think we should be focusing on older children. I've heard that many, many times, but that is not the way the money is currently funneled into our region. Here's your opportunity to tell the state what you'd like to see happen in Allegheny County. Thank you.
Thank you, Danae. We will now have Deborah Skillings.
Good morning. Good morning. My name is Deborah Phillips. I work with Pittsburgh Regional Transit, and today I'm going to introduce Maya Griffin. She started her career in the banking industry about 8 years ago as a tax coordinator. While in her role, she held 2 supervisory positions. Currently, Ms. Griffin is the community outreach, that's my title, I'm sorry, community health worker at Healthy Start. She is one of few who has a certificate in the community health industry in the state of Pennsylvania. Ms. Griffin is a former Healthy Start participant. She is a native of Pittsburgh. She is a mother of 3. During her downtime or her free time, she volunteers with the youth and as a cheerleader coach in her community of McKees Rocks. Miss Griffin.
Thank you so much, Deborah, for that introduction. I really appreciate that. Well, I am here to give you all a short story of my resilience in overcoming adversity. As a Black mother in 2022, I was diagnosed with anxiety, depression, because I tried to commit suicide after my 3rd child. I was taking mental health medication. I was having manic episodes. I was hospitalized and placed in a therapy group with predominantly white women. I could not relate to those women in that group at all. I was introduced to Healthy Start by Shonda Cunningham, who was a guest speaker at my group therapy session. She shared that Healthy Start had a postpartum doula program. This was really interesting to me because it was very challenging managing life with a new baby and as a single mom. Shonda called me and signed me up for Healthy Start, well, for a few Healthy Start programs personally. During the time that I was a participant, I received doula services from Serena Stevens Stewart. She would come to my home, support me with my babies, help me with household chores. She even held the baby while I cleaned and took care of myself. I was introduced to my home visitor, Miss April Tomei, who provided resources, coached me to keep going for the sake of my mental health and my children. April supported me with community resources, also introduced me to Taylor Pinkston. She is the therapist at our Moving Beyond Depression program here at Healthy Start. Taylor helped me focus on my self-care, not beating myself up for everything, creating realistic expectations for myself and as a woman and as a mother. I successfully completed the Moving Beyond Depression program and applied for our community health worker position at Healthy Start. But all in that same time, I received a 10-day eviction notice. But soon after, I got good news. I was hired at Healthy Start, but I had a few days before I started. I gave Miss April Tomei the news, and she did one last thing for me before my start date. She assists me with getting involved with with the Footbridge program to help me with my rental assistance so I can keep my house and afford it. Becoming a community health worker was an eye-opening experience. And my goal is to become a certified doula in the end. Healthy Start has taught me taught me the importance of advocacy, and I want to advocate for new moms and help them transition into parenting and their mental health. As a community health worker who was formerly a participant, I can pay it forward. It is an honor to me to see the importance of the support that Healthy Start from the support from Healthy Start from both sides as a participant and a service provider. My way and reason for doing this work is because I want to be a Miss April to someone else. Now, until then, I am currently 1 out of 355 certified community health workers in Pennsylvania, but we need more. So I am saying, yes, you can apply to Healthy Start and also apply to Allegheny County and community health work. We're in their homes. We're the front line. We're people who communicate on their level and help them understand the transitions that they go through. And now I am going to introduce Miss Sherelle Fulton. She is a parent. She is a community health advocate and a CAN co-lead. Thank you so much for listening, everyone.
Thank you, Maya, for that powerful and wonderful testimony. We really appreciate you sharing your personal journey with us. Now, I'm going to introduce the moderator of our first panel. Miss Yasmin Bennett Kelly is the Birth Initiative Director at Healthy Start and manages Allegheny County's Infant Health Equity Plan that provides community-based interventions and systems change approaches to improving Black maternal and child health while reducing poor birth outcomes amongst Black families. I am no longer accepting the things I cannot change. I am changing the things I cannot accept. This simple yet profound quote summarizes Yasmin's personal and professional pursuits, displaying a willingness to problem solve with a firm belief that with strategy, transparency, and focused efforts, significant results will follow. While her title and role has changed many times over the years, equity has remained at the center of her work. She is committed to having courageous conversations about race and advancing equity for Black women, parents, babies, and families. I welcome to the stage Miss Yasmin Bennett Kelly.
Thank you, Sherelle. First, I'd like to say good morning, everyone. I'm over here messing up my makeup a little bit because of Maya's story. And for me, it really resonates as someone who's also a new mom, as someone who's also a Black woman. It just speaks volumes to the work that we do, everyone in this room right now. And I think that it also just just gives us that perspective that sometimes we need to be reminded that all of these reports, all of this data that we are constantly reading about, that's constantly being shared out, these are real people, these are real women, these are real Black women with real stories. So I just like to say thank you, Maya, for your story. Thank you for your vulnerability. And we just appreciate you being in this space and sharing your story. So I'm happy to be on the professional panel today in that same note about talking about real stories and real people and things that are really impacting the Black families in our region. And so I have a few questions for our panelists. And I'm happy to pose those questions to our panelists today. Our panelists that we have are Taylor Clem, who is a doula, birth worker, herbalist, all things health, all things wellness. She is absolutely amazing. We also have Montia Brock, who is a therapist, clinician, birth worker, all of those amazing things. The list goes on and on. I would definitely take up a lot of our time today if I really went through and expressed how amazing all of these individuals are that we have on our panel. We also have Dr. Danielle Smith from Allegheny Health Network, and we also have Aisha Bowles, who is the clinical manager at Mercy. And so we have a large representation of birth workers, doulas, clinicians, people who work directly with patients, mothers, babies, and families. And so we have a few questions for you all today about how you manage systems of care, as well as including your social identities as Black women in the space working directly with Black families. And so my first question is especially for the healthcare professionals. My question is, as a Black and non-white healthcare professional, when working in predominantly white spaces, how does your racial identity shape your experiences and specifically your motivation to continue to do this work despite the documented inequities within the field? We know as Black women, we oftentimes do not have the privilege of viewing our work as simply work. We don't get to do this work from a scholarship perspective, but we do this from a real life and lived experience perspective. So if you could just tell us a little bit about how your social identity as a Black woman motivates you and keeps you encouraged to do this work.
I can go. I would say the biggest thing for me has been my shift from direct work to behind the scenes or admin or systems work. If you would have told me 4 years ago that I would not only be running my own business, but that I would be consulting, I would have laughed. I did not think consulting, teaching, speaking was something that I was good at, let alone would be interested in or could get paid in, until I had mentors and people show me. And it is definitely shaping how I'm able to work as a therapist, as a birth worker, as someone who provides direct services. It's hard when you're bumping your head up against a system, and then for the system to bump up against you when you're the patient. So knowing that I'm on the back end now with a voice, with resources, with connections to address the underlying issues is what keeps me going.
Thank you, Montia.
Good morning. I will also speak to that. So I am one of the practice administrators and supervisors at Pittsburgh Mercy in our adult outpatient department. I like Montia because I grew up in Allegheny County. I've learned here, taught here, worshiped here, shared here. I raised my children in Allegheny County. And I always recognized that being an African American female professional, I always had to conduct myself, behave a certain way, speak a certain way, because I was not only showing up for myself, but for the members of my community. And how individuals that I worked with within predominantly white environments, how they experienced me could very well influence their future perspectives of other Black female professionals coming in the door. So yes, like you mentioned, we are there to do a job that we're hired to do, but there's a higher level of responsibility that comes the moment we walk in that room, the minute we sit at that table, the moment we open our voices. There is a responsibility, and that we are sort of like an echo. That we are an echo of the other Black professionals that sat in that seat or in that room prior to us. And now we are just continuing that ripple effect being change agents in the spaces and places at times we don't even want to be in. I often, as the only woman of color sitting at the administrative table at Pittsburgh Mercy, it is very stressful, frustrating, and overwhelming at times when I hear some of the implicit biases and comments that are being made towards members of our community. But then I am reminded that is the very reason I am at the table. And so I'm thankful, and I just want to definitely acknowledge all of you, all of the voices that have spoken up to this point, Danae, and I mean just all of you, and it just makes me ever so grateful to be a Black female professional in Allegheny County right now, seeing all of the changes that are coming forth, and to be a part of that change. So I thank you.
Thank you so much, Ms. Bowles. Dr. Danielle Smith.
Yeah. Good morning. It's a privilege to be here. I've benefited so much from just listening to all of the presentations and the testimonial thus far. That's a heavy question, actually. And some of the things that come up for me, one is that if not me, then who? When you have been given an opportunity to be in certain spaces where your voice can be an agent for change and also influence, as was said just now, it is a heavy weight, a responsibility, but it's also a privilege. And I think about the fact that as a Black woman and as a Black female physician and OBGYN, across the nation, there are about 10% overall of Black OBGYNs. And it matters, it makes a difference. We understand that physician-patient concordance as it relates to race contributes, I would say, to improved outcomes. And so, I know all of the Black OBGYNs, I would say, in Allegheny County. And, I would say that probably we don't yet reach 10%, but if not me, then who, right? I would also say that particularly as a Black woman, one of the things that I have to focus on for myself is that I cannot pour from an empty cup. And so for not only myself, but and also for the many people that I am entrusted to provide care for, I'm always encouraging each of us to give to others of the overflow, and so fill our cup first and give of the overflow, because it's really how this all becomes sustainable. Because as Danae mentioned, it is not something, we are not where we are. It didn't happen overnight. It will take sustained work to change outcomes and to improve outcomes across this county. But if we all burn out in the process, we will just we'll keep on circling back to the same space. So as I said, I'm really happy to be here today. This fills my cup. And so I appreciate the opportunity.
Thank you so much for that, Dr. Danielle Smith-Lebsey. Some of the things that I hear so far are community. I hear us saying that the village does still exist and that we do have folks who are in places and who are able to advocate for our Black families. Although it can often feel like we're working in silos and like we have lost that sense of community in the Black community, I think the conversations that we're having today just go to show that it does still exist. My next question is for anyone in this space in the panel today. I want to know, just following off of Dr. Danielle Smith-Lebsey's comment, what do you believe is the importance of having more Black medical professionals in the mental and physical health spaces? You've all spoke to how you identify as a Black woman and how that contributes to your experience as a Black female professional. But I want to know, how do you think that contributes and empowers or impacts the families that you serve or even yourself? And that's open to any of the panelists.
Welcome. Well, I can answer. I'm Taylor, and I'm grateful to be in this space. I've been listening, and I'm really just grateful to be in this panel as well, and just amongst you all. And I I think it's very important to be culturally relevant. The work that I do is really culturally relevant, and it speaks to a specific people, and it shares that specific information that relates to that people and their history and their ancestral wisdom. So it's very important because it's a language. Everything is language. So when you're speaking someone's language, when you look like that person that you're speaking to, when you're speaking to them with that language that they understand, when you're showing up and sharing things that they can connect to, it's everything. You can actually hear, a lot of times when people are in spaces, or even if I'm thinking about a school environment, or a doctor's environment where we go into these spaces, they don't look like us, they don't speak our language, the communication isn't there. We're not communicating. We don't hear what's going on. So it's very important that we show up and we represent like culturally relevant information and exchanges.
Thank you for that, Taylor. I know that you are doing some amazing work with your programs in the city, especially just contributing to the systems of care for Black families. So if you could speak a little bit about how you bring your knowledge and expertise to the table when we're discussing health and better health outcomes for Black families.
Yeah, thank you, Yasmin, so much. Yeah, so nutrition. So I'm big on plant food and medicine, and as well as like tapping into our ancestral wisdom around that. The people that came before us really knew well. They knew how to live off the land. They knew that the spring greens that are popping up right now, to go to them to help, cleanse out the body. They just were really wise, and they knew how to take care of themselves. And that's what I do. I teach ancestral wisdom around food and around birth, and bringing those two together, it determines our environment. So our healthy environment. So how we birth our communities and what we eat are two like essential things in our environment. So we have to make sure that we're focusing on them. And that's what I do from that ancestral wellness approach. And so, like you mentioned right now, I'm thinking about all the connections happening. So we're starting our nutrition training for maternal wellness professionals this April. And so we'll have 5 cohorts of those trainings. We jumpstart our training last season. And I'm just thinking about all the folks who we can just have in a space, from Maya to just all these people that we're interacting with today. I'm just grateful. And I'm to be here and sharing that type of wisdom.
Thank you so much, Taylor. My next question is regarding postpartum depression. And so we've heard a little bit about Maya Griffin, about her experience with postpartum depression. And so I'd like to just have a little moment to discuss this. So data shows that postpartum depression can affect mothers far beyond the immediate birthing experience, sometimes into the early childhood years. When thinking of postpartum care, do providers feel that assessing mothers once during the early postpartum period up to 6 weeks after childbirth is sufficient in catching or combating postpartum depression?
No. One of my biggest issues with assessing for postpartum depression is the scale that we're currently using, which is reliable, is also very familiar. So these families are seeing this scale with their community health worker, with their OB, with their PCP. So I personally worry about if a person is answering truthfully, or if they're just kind of scrolling. And back to what Taylor said, is the relationship there, is the communication there? Are we assessing for the sake of connecting them to resources and supporting them? Or are we assessing for the sake of assessing, just to say that we did it? Another issue for me with treating postpartum depression is, why are we only talking about the mother or the birthing person's mental and spiritual and physiological health after the baby? Why aren't we talking to families while they're pregnant? Why aren't we addressing them when we know that they've conceived and we know that they've had a history of postpartum depression? So those are my thoughts.
Thank you so much for that. Any of our other healthcare professionals in the space want to offer a perspective?
Yeah, just to add to what Montia just mentioned as well, and thank you again, Taylor, for your sharing, and just that, it goes along with the former question of when a person walks into a space and they see someone that looks like them and the need for that connection. And that's the word that continues to come to mind is connection, because we want individuals to feel comfortable and safe enough to say that I have had thoughts of harming my child during this time, and be able to understand that they are in safe hands and the information that they are sharing with us is going to be utilized in a way to keep themselves safe and their children safe, to facilitate healing. Because a lot of times, again, within larger community mental health organizations and agencies, being a mandated reporter creates a huge responsibility when someone says something to us. But we have to be sensitive to the fact that this person has come to us, has been honest, and reached out to us for care to address a real need in real time. And we want to be mindful that before we make that call, the impact that will have once that call is made. And are we ready to deal with the after effects and the residual effects of that happening? Too often than not, and we know the disparities, we've talked about the disparities, that Black mothers are more likely to be reported in Childline than white mothers, who have expressed the same sentiments, the same concerns, the same fears regarding how I'm feeling right now. I feel like I could possibly harm my child, and they will get additional supports, additional help. But our moms are immediately childlined, and we know that once they are involved in the systems, the systemic trauma that happens at that point. So I just wanted to speak to that just a little bit when we're talking about postpartum depression and understanding the symptoms that come with it, and that it's not always a red flag that the mother is going to harm her child. It's just some of the symptoms and feelings that she's having at that time, and how we can clinically and appropriately tend to those symptoms so that the mother can heal and build connection and secure attachments with her baby.
Thank you so much. And as a follow-up, just for our own learning in this space, if any of the medical professionals or healthcare professionals in the space could just clarify what is actually considered the postpartum period. I see that there is a lot of different discussions about whether it's 6 weeks, whether it's 12 months, whether it's early into the early childhood years. If you could just provide a perspective as to how you can identify what is truly the postpartum period.
I personally, I'm sorry, go ahead, Dr. Danielle.
Please, Marcia, you go ahead first. And then, yeah.
I personally view the postpartum period as that first year after birth or loss. I believe that that's left out a lot. There is still a postpartum period that happens, whether that is a miscarriage, stillbirth, etc. So that first year after that.
I agree. And I think that a part of the opportunity for providers is to educate in the early postpartum period about the signs of postpartum blues, how blues are differentiated from postpartum depression, but how it's all a continuum, and that you can that postpartum depression can happen and occur at any point. It's not just in the first few weeks of that early transition after birth or loss. And so I think education is a really key part of that. And to me, the supports that moms need in that year and beyond, I think offer an opportunity for providers and the community to partner, right, in this space, and to have known channels of what we would otherwise say are warm handoffs. I saw this patient in the office, and I can tell that, I try to see patients back at 3 to 6 months again after their postpartum visit, which typically occurs at 6 to 8 weeks, because I think it's very common for once you've delivered, you lose, unless you get pregnant again in, the next year or two. Oftentimes, we don't come back for care for several years, which I think is a lost opportunity to really impact not only a woman's health, but also the health of her family. And so I think it's an opportunity for the community and the healthcare system to partner, because neither of us can do it alone, right? So.
Absolutely. Thank you so much for sharing your perspectives. I think as a new mother, something that has been very challenging is just the plethora of pieces of information and the difference in information that's constantly shared, through the internet, through social media. There's always different things being shared about what is actually considered postpartum depression, or what is actually considered the postpartum period. You have folks saying, well, that's just baby blues and that's not actually postpartum. And so it's very important and powerful to hear you all speak to that as actual professionals in the field. For my last question, I would just like to bring your entire self to the space, as you are Black female professionals working directly with Black families and just kind of on the front line supporting our community. Dr. Danielle Smith-Lepsey talked about pouring into herself and filling her cup. So if you could share a little bit about us from your own personal perspective, how are you pouring into yourself? How are you filling your cup as a Black woman in this space?
Well, I would say that one, I try to maintain a high level of physical activity. I think that's really important. There's so much that, that comes, as we said, now that I'm in my late 40s, you realize that all the things that you did up until now, right, come back. And I believe that there are many ways to live well, but you have to invest in eating well and exercise. And so I am often each weekend walking with a good friend of mine who's also a physician here in Pittsburgh, and we walk, every week at least 3-4 miles, because not only walking, we're talking, we are, connecting about the challenges of, being who we are in these spaces. And, I also feel like one of the benefits of the pandemic was that you can now access various mental health services for yourself, and for those who are in your network virtually. And so, I have a coach, therapist, executive coach person who is based in Philadelphia, and really has been vital for me as I'm navigating, as I said, not only being in these various spaces and the heaviness of what we're talking about on a day-to-day basis. It's hard to talk about, mothering and Black mothers dying and babies dying. That's heavy, right? So you need an outlet for that. But also life is life, right? And so as a member of now a sandwich generation, and caring for elderly parents, that also requires its own, that requires me to, again, look there and be very intentional about filling my cup. So I try to, put boundaries in. That's also really important, right? What boundaries do we have for home, for work? And I try to always remember, I would say, last and first, that the only place that I am truly irreplaceable is at home. And so work is important, but I got to remember where I am truly irreplaceable and really invest in that space.
Absolutely. Thank you so much. I hope that we can all take something very valuable from what Dr. Danielle Smith-Lepsey shared with us about pouring into ourselves, about filling our cups, and about taking care of ourselves. We are now going to move forward to the next part of our agenda. So first, I would like to say thank you to our professional panel, and we greatly appreciate you. Thank you so much. I'm now going to introduce Ms. Monique Olives, who is from our CAN and our Community Health Advocate Program.
Okay, good morning. My name is Monique. Currently a CAN committee member and also a community health advocate. And I am going to introduce the lovely Sherelle Fulton. She is a mother of three, a community health advocate. She is a doula and a longtime Healthy Start participant. She has received in various she has served in various roles throughout the community and has, and has gained many years of experience doing so. Her passion is working with families to gain whatever it is they feel they need to achieve self sufficiency. She knows that helping one family bridges the gap to help others. Um, Things that they face is just up. Well, she hopes to help. I'm sorry. Hold on one second. She knows that helping one family bridge the gaps that they face isn't just a benefit to that particular family, but to the community as a whole. Please welcome to this forum the lovely Miss Sherelle Fulton. Thank you.
Thank you so much, Miss Monique. I am here to share a testimonial with you, but I also want to say thank you to everyone who is still on this call with us, who's holding on strong. That first panel was beautiful. We appreciate all of the knowledge and everything that you all came to share, and we really, are so thankful and grateful that you're here to help, educate and empower our families. So at 21 years old, I was a college student working part-time, and I found myself pregnant. Not making much money made it stressful to afford food and other expenses that I needed. During this time, I heavily relied on WIC to fill the gaps in my refrigerator. I was so thankful to have even the smallest amount of assistance. WIC was a great help, but it was very difficult to actually use this benefit. I did not live in an area where bus service connected me directly to a grocery store that actually accepted WIC benefits, but I still had to do what I had to do. I had to make a way to get there because I wanted to do what was best for myself and my baby. Even though I tried to do what was best for both of us, at 26 weeks, I delivered my son. He weighed 1 pound, 14 ounces. He spent 91 days in the NICU due to hydrocephalus and many other conditions related to his prematurity. When I arrived at the hospital, my situation was treated with some urgency, but not from every provider that I encountered. This was very upsetting for myself and for my family. As I was taken back to the emergency room, a little more things were explained to me, but still there was a sense that, okay, this was just a run-of-the-mill thing. This is something that we experience as providers. So it felt like there was no compassion for us as the family. As my emergency C-section went as planned, my personal physician, the great Dr. Robert L. Thompson, eventually arrived to supervise my emergency C-section. He explained some things to me. He put his hand on my shoulder. He provided some comforting words to me. After I delivered my son, like I said, he spent a lot of time in the NICU, which means I spent a lot of time in the NICU as well. I was encouraged to pump to provide nourishment for him, but I was told that I would never be able to actually nurse him at the breast. I was not encouraged to try to do so once we were able to, and that was very disheartening to me because I wanted to breastfeed my baby. In the NICU, I was provided a food stipend to help purchase food or any other snacks or whatever that I may have needed, but that didn't suffice all of the expenses that occur whenever someone is having an extended stay in the NICU. There's parking, there's bus fare, there's gas, and there's the need for other personal items, not just food. I also was not encouraged to do other things to keep myself healthy, mentally, physically, or emotionally. Eventually, the hospital social worker did share some information with us about much needed financial support, but what about everything else? Through it all, though, we survived the many surgeries that he had to experience, the countless nights of no sleep, the back and forth between McGee Hospital and Children's Hospital, and just the uncertainty of our child's health. I share all of this with you to shed light on the importance of things like a living wage so families can afford the care that they actually need, adequate paid leave so families can actually heal and bond with their babies, and crucial funding to programs like early childhood. So when it's time, families can go back to work. Families can put their children in safe, caring, educational environments and not have to worry. The twists and turns that families experience when entering the medical system are somewhat inevitable. We don't know what's going to happen with our health, with our pregnancies. But what can you do to ensure that families are supported properly? Thank you so much for listening. Next, we will have our legislative panel, and we will have our wonderful Latavia Michael introduce our moderator. Thank you.
Hi, my name is Latavia Michael. I'm the community health advocate and co-lead with Sherelle, and I want to introduce you to Bernasia Young. Bernasia is a disruptor and public policy advocate and campaign coordinator based in Pittsburgh. And I want to say that again. Bernasia Young is a disruptor, public policy advocate, and campaign coordinator based in Pittsburgh. And I said that twice because that was the energy I got the first day I met Bernasia. I wanted to be on a team with her. I wanted her to basically be with me everywhere I go because she is a positive disruptor, not a negative disruptor, a positive disruptor. And I feel like that's what I want to be when I reach the goals that I want to accomplish. Okay. She is fierce. She is the public policy advocate by trade and has a passion for the work she does. She is currently our policy and advocacy project manager at Healthy Start, and she is a consultant with the YWCA Greater Pittsburgh Race and Cultural Department. Bernasia strongly believes that having both a strong personal village and dedicated professional community are the keys to making large strides in a reality that is institutionally designed to keep people oppressed. At the moment, she is focused on reforming policies around Black women's reproductive health, comprehensive health, education in public schools, and pay equity. She knows that voices matter, especially in the world of policy. Mimicking the words of her alma mater, be safe and be well. Bernasia Young, everybody.
I never know how I'm supposed to follow up introductions or even past moderators because they're so good. It always gives like imposter syndrome, but nonetheless, I'm really excited to be here and be able to present our legislative panel. Obviously, this is something I do in my professional and personal life, so I always get a fangirly, starry-eyed kind of look whenever I see our legislators pop on. And with that said, I would like to introduce the 4 legislators we have on the call today for the legislative panel by district. So we have Senator Jay Costa for the 43rd District. We have Representative Johanny Cepeda Freitas of the 129th District. We have Representative Lindsay Powell of the 21st District. And then we have Representative Joe McAndrew of my local 32nd Penn Hills District. And with that, I would like to lay a few house rules. I would like you guys to just quickly give a descriptor of what you look like and what you're wearing for folks who may have some sort of visual impairment. That way we know, who's speaking, who's talking, and who's in the room today. And then I will go ahead and begin moderating and present the questions to you all. Actually, we're going to do that in reverse. I'm going to present the questions, and then we can kick it off. So the first question that I have today is, obviously, after the funding, the budget was introduced by Governor Shapiro. We know that funding to nutritional programs such as WIC have always been at risk for budget cuts consistently for many years. And we know that these programs are essential to communities that already struggle with food insecurities, like not having access to primary grocery stores. As legislative officials, how do you ensure that the priority is to fund programs like WIC, SNAP, and local food banks? And with that, I'm going to pass it to Representative Lindsay Powell first, and then follow up with whomever.
All right. Well, thank you all so much for your time. As said, I'm State Representative Lindsay Powell. She, her pronouns. I'm wearing a green dress with gold earrings. To the point of how do we ensure that these programs stick around? I think continuous advocacy. I'm so grateful to be a part of a General Assembly here that values putting people first. It's essential that when you're thinking about legislation and you're thinking about policy, you're centering the people. You're centering their experiences and you're centering their hardships. And so when we go to Harrisburg and in our district offices every day, I know that it's at the utmost importance to myself and my colleagues that we're thinking about the lived experiences, some of which that were shared today, that our neighbors, our community members, our loved ones face. When it comes logistically to that, I think as a caucus, we fight day in and day out to ensure that the legislative priorities that our community needs are at the forefront. Particularly in this space, I'm so grateful to be a part of the Black Maternal Health Caucus, and I want to lift up the work of my dear friend and colleague, State Representative Latasha D. Mays, as well as State Representative Gina Curry and State Representative Morgan Cephas that have been leading this work. As a new representative, it was deeply important to me that one of the first caucuses that I joined was the Black Maternal Health Caucus that, again, centers the lived experience of Black women, femmes, and birthing people to ensure that their birthing experience is dignified and safe. We've already gone over the statistics and the horrific stories of maltreatment, of discrepancy in outcomes for both mother and baby. We know that as a Black person in Allegheny County, you are far more likely to experience harm. And so using those experiences and elevating those voices and stories is critical, is a critical part of the Black Maternal Health Caucus and fighting for legislation, including the introduction of the Momnibus, which is a package of legislation that closely mirrors the federal level legislation. Is exactly the type of work that we need to do and the type of work that I myself and my colleagues will always champion.
Thank you so much for that response. Would anybody else like to follow up? Senator Costa, if you're speaking, you are muted.
I apologize. Thank you. State Senator Jay Costa. I'm wearing a gray sport coat with a light lavender shirt, checkered shirt. Thank you all very much. I truly enjoyed the conversation over the past hour and a half or so, learning more about not only the personal experiences, but the presentations that were made. And it goes right to the heart of how we were able to address what needs to be done and to maintain resources and funding for programs that we all talked about. I can tell you as Democratic leader in the Senate, we have prioritized many of the things we've talked about, and that information you can find that at senatorcosta.com or at senatedemocrats.com, where you'll see our legislative priorities and policy priorities for our caucus, of which include many things, as I mentioned, that we talked about today. But advocacy is essential, and unless folks are advocating to maintain and grow the resources for the programs we talked about, it's not going to happen. And it's true that over the years, they have been oftentimes been at risk, but it's the collective voices of the folks who are on the call today, advocating in different spaces and different areas and different purposes that allow us to reach the conclusion that we need to maintain the programs and make additional investments along those lines. So I think this conversation today is extremely important. While it's great to have my colleagues on the phone, we need to broaden this conversation with a number of other folks as we go forward. And I'm hopeful that I will share with you that I will certainly bring this conversation to my colleagues in Harrisburg next week. But just know that this advocacy on a consistent basis, not only around budget stuff, but around consistently talking about things of this nature, how valuable that is to be able to achieve the goals that we're looking for. So thank you.
Hi, good morning. I'm State Representative Johanny Cepeda Freitas. I'm wearing pink. I represent the 129th Legislative District, which is in Berks County. I want to thank you all for hosting, for inviting me, for welcoming us, and to be in the space. I've been very inspired by the testimonials, by what everyone has had to contribute. Thank you to all who have shared personal stories. I too can directly relate, having my first child was a stillbirth, so I have a devastating, traumatizing experience that I unfortunately went through with my very first child. That I'm willing to share at another time. But nonetheless, very passionate about this work. Also a member of the Pennsylvania Black Maternal Health Caucus, and I want to say that empowering our community to advocate for themselves is key, but we have to be very intentional about the advocacy work that we do, because my colleagues who are here in the space, we're all fighting for the needs of all people in our communities. We're on the same team, we're on the same side. And I think that we have to teach members of our community to be very specific about how they advocate, who they advocate to, and using all means, whether it's social media, whether it's showing up, whether it's making phone calls, whether it's writing letters, but we really have to rally our community. We got to make it very grassroots oriented and get in our legislators' spaces and faces, right? And holding legislators accountable. And so, if I can leave you with something, it's like we all know what's necessary for the sake of our moms in our community, for our children in our community, but we have to be very specific and intentional with how we task our community to advocate for themselves. Thank you.
I'm State Representative Joe McAndrew. I'm a chubby white Irish guy wearing a blue shirt. Not even green, even though it's St. Patrick's Day. Anyways, it's nice to meet everybody. I really appreciate all of the time that you've taken to really elate us to where you're seeing things, how you're envisioning things, and where the county is going as well. I wanted to start off with kind of touching base something on what Joanne said, but also in my own experience. Several weeks into our first baby, we ended up losing one of our children as well. And so I understand the heartbreak of losing a child and how that affects one's life, and not only, in the immediate, whenever it first happens, but the long-term effects of it. And, learning that it can be systematic in our communities is really, really, a devastating thing as a legislator, excuse me. And I really feel for it and want to strive to find solutions to make sure that there are better outcomes for our children and for our future in this state. To get back to your original question about the WIC, I really think that what we need to do is be looking at the nuances inside the particularly the funding caps and how people are getting allocated money. There's just been different standards that have come from the federal government, and increases to Social Security, increases to different things that have really put some people out of the, ability. There, the caps that we currently have, which are slightly outdated, for people to be able to qualify to get the effective food that they need for their, especially with the cost of groceries going up, the effective food that they need to survive and survive a healthy life. And so one of the things I think we should be looking at is not only increasing the funding to this, but really looking at like the levels on how we are making sure that people get the resources that they need, that they're not, stuck in a structure that is of a yesterday's policy. And so I hope that as we look at these policies, that's what I hope we'll be looking at.
Thank you all so much for your response to that question. I know these are relatively loaded questions, and I appreciate the authenticity from every one of you. Keeping in line with the concept of budget cuts, especially at the state level, and I'd like to go to Representative McAndrew first on this, because I know you have a particular interest with transportation. So state transportation budget cuts lead to the removal of essential bus routes, particularly in marginalized communities. And that often results in mothers missing work, having to travel many hours on multiple bus lines, and overall inaccessibility to affordable transportation. So at the state level, how can we ensure that access to affordable transportation does not become a topic of budget negotiation?
I hate to say it like this, but it already is. There's already Republicans and people who are in our rural communities who are asking why should we be giving SEPTA more money? Why should we be giving PRT more money? Like why? And so if we're looking at it's an unfortunate circumstance, but it is already in the lines of the conversation around the budget, and I'm sure it will be a piece that we will have to fight to negotiate. And now in terms of budget cuts, actually in the governor's proposal, um, he fought for increases or is fighting for increases to our public transportation system. At the same day he proposed that, it was kind of cool. In the rotunda of the House, because we were sitting on the rotunda, not on the floor, because of some work that was being done, it was announced that I am now the new subcommittee chair on public transportation. And I think that's a notable thing because the chair of our transportation committee is from Philadelphia. I'm from Allegheny County, and so it allows the perspective of what's going on in Allegheny County and in this region to enter into that conversation. And as the subcommittee chair on this, I find it to be an extremely, extremely important issue as we look at what is going on with not only just with PRT's bus line redesign, but also other regions' bus lines redesigns, including SEPTA. The one thing I really think that we need to focus on as a community is making sure that the PRT is aware as possible that you are cognizant and we are cognizant of what they're doing in terms of their bus line redesign. Realistically, I understand that a BRT from Oakland to the city, is a really strong initiative that hopefully spurs some economic growth. But it's not an infinite pool, it's a zero-sum game. And so if they are adding resources into one region or one area, that really means that they're taking resources from other areas to compensate for that. We do not have enough bus drivers, we do not have enough funding, and so we have to find these solutions. And so I'm really curious about how this bus line redesign really continues to be built out to make sure that is supporting all people. I think Sarah, our county executive, is doing a good job of making sure that she is, informing the PRT of what she believes is best through her all-in surveys. But also, please be cognizant there are going to be many more opportunities for public input into the bus line redesign for our county, and we need your voices there. We need you to make sure that you're there advocating for the women and families that need these public transportations in areas that are not necessarily the most economically influent. And so how do we make sure that that is the case? And so in my goal, or in our goal as a state legislature, I think overall our focus has to be, hopefully the PRT gives us a good playbook that we are able to take back to the state and advocate as quarterbacks and as players of the team to get the funding necessary for our region to make sure that that playbook is executed appropriately. And so that's kind of where I'm at on it at the moment.
Thank you. Would any of your colleagues like to follow up? Senator Costa, you are muted.
I'm sorry. This is Jay Costa again. I think Representative McAndrew is right on point in terms of how he described what the challenge is. There's no question that we have work to do here to ensure that we have adequate resources. The governor's put forth a bold proposal to support transit across this Commonwealth with a focus on the two primary areas. But the pushback has been in the more rural areas where they don't rely upon transit as much as we do here, particularly given the needs that we have here, particularly in a lot of communities that already are underserved, and how we're going to grow those communities to be able to have access to that, which feeds into the whole conversation about folks having access to work, particularly given the nature of the workforce here in parts of Pittsburgh, a 24/7 type working environment. So he was right on the mark, and I think it's about advocacy and making sure that folks are speaking up about these things, again, year round, not just around budget time. To the question that was raised in the chat about how do we ensure that folks' voices, even when they speak up, their voices are being heard. That's where you have to hold your members accountable to listen to what you have to say. And I think that's what's really important. So, and if they're not accountable, that you take steps to be able to remind them consistently that they're not being accountable or not listening to what's being said. They may be listening to you, but they're not hearing you and they're not taking steps to address it. And there's frustration along those lines. But at the end of the day, not speaking up or being discouraged to speak up is not where we need to be. We need to be able to be vigilant in doing what we do in terms of communicating with our elected officials as much as possible. Thank you.
I don't know if we have time. If I could add very briefly, State Representative Lindsay Powell, I think it's also an opportunity to be intentional about what improved transit options look like for our communities. It's not just we want kind of more buses. We want the frequency to increase in the neighborhoods that we live in. We want to ensure that when we do have new buses come online, that they're able to be electric so that we have an opportunity to think about our future and to make investments into a green future that allows for better health for all of our communities, especially the ones that are historically been left out of these conversations and historically divested from. I think it's also an opportunity to talk about workforce. Are we talking about, as my colleague, State Representative Joe McAndrew mentioned, if we have a bus driver shortage, how can we make sure that people from our communities have the opportunity as well to work in these spaces? And so I'm grateful for coalitions like these that are thinking about these questions and thinking about them from an intersectional way that we can utilize investments that our Governor Shapiro has, acknowledged that he'd like to pour into Pittsburgh, as well as at the federal level with Secretary Buttigieg, who's also been to Pittsburgh, wants to invest in our regional transportation economy. But how can we do this in a way that addresses multiple issues, particularly in our Black communities, that we know we need addressed?
All right, thank you all again for the transparent responses. One of the final questions that I have for the sake of time is, considering the lack of affordable quality housing in specifically densely populated minority areas, what is being done at the state level to make unhealthy neighborhoods healthy?
Well, I think this is Jay Costa speaking again. I think there are a number of things that have been done that I think we need to continue to pursue. Certainly, one of the things that have helped stabilize homes and individual families and neighborhoods is the work that our county executive has done with regard to the whole home repair program. I think that is a program that we need to continue to invest state dollars into it as we go forward and build upon the good work that the county intends to do in that space. We're very fortunate to have a county executive who is focusing and highlighting housing in our county, and I think that's extremely important going forward to allow us the opportunity to join forces with a lot of organizations that are working in this space. We're continuing to work on other programs at the state level. Just this past week, we learned, I work closely with PHFA, which is the Pennsylvania Housing Finance Authority, and learned this week that we're going to be able to provide about $400 million into PHFA from federal money that will allow for a tremendous increase in the number of what's referred to as 4% affordable housing projects across the Commonwealth. And what that means is, for example, the low-income housing tax credit program that provides about 1,200 units across the state each year with a 9% program. With this infusion of $400 million, we'll be able to do a considerable number of 4% projects, programs that will increase that, will double that, additional 1,100 units across Pennsylvania affordable housing for the next several years is tremendously important. We just have to be able to work closely and provide the resources along those lines. Over the course of the past couple of years, Senate Democrats working with our House Democratic colleagues have put, for example, a program we developed was called the Housing Opportunity Program, HOP program, $100 million that went across the Commonwealth, where we in Allegheny County probably received the highest proportion per capita across the state because we've advocated and helped create it. Putting resources back into housing, affordable housing, community housing that allowed the restoration in many places, the rehabilitation or preservation, and even some new work that was being done. So this has been an area where we have been trying very hard to be able to grow neighborhoods, restore neighborhoods and the like, and make more resources available. I work closely with then County Executive Rich Fitzgerald, and also and Mayor Gainey. We put almost $10 million into conversion housing for downtown Pittsburgh with an emphasis towards affordability. The county and the city have come together and looking for a bucket of money to do more in that space, and we'll continue to be able to do that. But there's a carve out for affordability in those spaces as well. So it's about making investments at the end of the day in housing and acknowledging that we need to do more, and having the folks available to do that is really what's important. So again, it's advocacy and an acknowledgement that we know we have to do more and be standing together to be able to say that. So, but we've done some things and we'll continue to grow those type of things. All the things I've mentioned that were done in 2022 and 23, we're looking to do again in 24, but use state resources for that purpose.
So overall, we are seeing a situation in this city and in this region where there is gentrification and there are populations moving around. And particularly, I've seen that while I don't represent the city, I've seen it in the city in places like East Liberty or other places, other regions that we have seen people getting pushed out of their, where their family is really settled and into new regions. And the working people are really feeling the squeeze on that. Not only are they feeling that gentrification of having to find a new place to live, but then on the back end, you see markets that have affordable houses, they're getting bought up by corporations. And so we see, the city of Pittsburgh, 1 in 3 houses, almost 1 in 3 houses getting bought by corporations. We see in Pinellas here, 1 in 4 houses getting bought by corporations. And so whenever you talk about a working mother who's trying to afford a house that she could start a new family in and grow that family in and hopefully build that generational wealth, well, she's getting forced to move, and then she's getting told, well, now you have to live in a corporate house. And how right is that? And so whenever we're looking at policies or other things that are going to affect, the people in affordable housing in our region, I truly feel that we have to look at, how are we making sure that these, not only are there programs to set up that, give additional housing stock, but also what are we doing to make sure that we are giving those people the first opportunity at the American dream? And corporations buying houses the way they are is not allowing us to facilitate the American dream to a generation of people, particularly those who are, of minority and ethnic regions. And so overall, one of the bills that I'm proposing would, we've seen a shift in like foreclosed properties over to and sheriff sales over to online platforms. It would really add safeguards around that to prevent, or give the first shot of opportunity of buying houses or other housing stock to people versus corporations. And so I've been working on that. I think it's a very important issue. And I think that we should be looking at that in the policy as a whole for the entire state. There should be registries and other things that created to make sure that we are giving, the housing stock, which is one of the last bastions of wealth we have in the middle and working class, to the middle and working class, and not to the ultra wealthy like Blackstone and other companies that are coming in and buying these properties. And so, I think, owning a home is not just an American dream, but a single mother who's owning a home and raising their family there, they take pride in that community. They take pride in their kids' education. They take pride in this, and it builds a healthy community. And if we're just getting undermined by that so much in our lives, it has a negative effect on us that it trickles down to all parts of our lives. And so that's what I hope that we see in Harrisburg's policy that is around not only building housing stock, but also giving the opportunity for first-time home buyers to buy homes versus corporations buying them.
Thank you so much for that. Again, keeping with time, it is 11:01, so I don't want to go over too much longer, but I do want to acknowledge and pay heed to the live chat questions, specifically one where it asks, what advice can you share with constituents who may feel unheard, even when they express concerns with their officials? And I'd specifically like to ask that to Representative Powell and Representative Cepeda-Freitas, as your constituency is more likely to look like you than others do. So can you provide or shed some light to that question?
State Representative Lindsay Powell. I'm happy to start. I'm sorry. Hold us accountable. We're only in these roles, all of us, not just the four of us on this call, but across the Commonwealth. We're only in these roles because the public puts us in these roles. I think it's a constant reminder when you have a constituency that shows up at your door, that's knocking on your door, that's giving you phone calls, and inviting you to events. It should be a constant reminder that these seats are a privilege and an honor, and making sure that people know, that the public knows, or excuse me, that the public has the ability to remind us every chance that we get, that they get, that that these seats are an honor is so important. On our end, and I know especially with the legislators on this call, we are deeply committed to true community engagement. I think it's really easy to put out a flyer and say, well, you missed it. We had it up on the library and, we had an opportunity to meet and you didn't show up, so it's on you. But I know personally from every single one of these legislators, we are deeply committed to true community engagement. And what that looks like to me is not just showing up to where you're invited, the fancy ribbon cutting, the, nice panel, like that's all well and good and deeply important, but also, are you showing up to those informal events? Going to the pickup line at the schools? Are you thinking about opportunities to be in the libraries? True community engagement is not just when it's convenient, when it's kind of wrapped in formality. It's the everyday interactions that you have with your neighbors and making space and time to meet people where they are. Not everyone feels comfortable going to City Hall or going to your office. What are you doing to get in the community? And so I know from firsthand experience, the legislators on this call do that. And as a new legislator, I have learned from them as well on how to do that well, but also making sure that you're accessible and truly relevant for the communities that I serve. And this has come up on this legislative panel this morning already, but cultural relevancy is deeply important. When we host meetings, I know for a lot of my community members who come from working class families, it's important to provide food because someone might not have eaten dinner that night. It's important to provide childcare if we can, to make sure that or make it a child safe space so that if people do need to bring their kids, that they're welcome and that they're invited. And so true community engagement looks like reflecting the needs of the community, meeting people where they are, and being culturally relevant to the constituents that you serve. And reminding, as a public, reminding us all the time that not only is it responsible of us to do that, it's our duty to do that. I think breeds more of a intentional relationship between elected officials and the public.
Thank you, Representative Powell. She pretty much summed it up. I'll just add a few more. I think obviously, my words of advice is stay persistent to our community members. And as Representative Powell emphasized, holding us accountable is important. I know that for me, in my space, in my legislative role, well, first of all, I never imagined being in this space. I hated politics. However, life led me here. The needs of my community led me here. The need to represent that voice that oftentimes doesn't get heard was important, and that's what led me here. But how I use my team and my staff, we are in spaces whether we're invited or not. I make sure that we attend also our local school board, our local city council meetings, that even when we're in the high schools, or even when I'm, the Read Across America program, even when I'm in front of like first graders, empowering them to use their voice. It doesn't matter how young or how old or what you look like. Everyone is entitled to express that voice. And I have an open door policy, and I give out cards, and I use every means and every resource available to me, whether I'm making phone calls, whether it's a robocall, whether it's social media, whether if I'm in the physical space, I lead by example. So I make sure that it doesn't matter. And also the accessibility of language. Right. So in my community, for example, there's a growing Haitian population. So I've taken it upon myself to translate like our basic services in Creole, for example. So to me, it's like, I want everyone to be heard, and I work for you, and I work for my constituents, right? And I make it clear that they're my bosses, and I get marching orders from them. And so it's important for them to always hold me accountable and hold all legislators accountable. And, I think it's extremely important that we stress civic engagement in beginning in early childhood and beyond and throughout, because that's how we empower members of our community to really use their voice. You know, some people don't know that they even have a voice. And to me, it's also important letting people know and reminding them that everyone has power, an abundance of power, and we got to recognize and own that power and put it to use. So thank you again for having us in this space. I know we're almost out of time. You know, I appreciate and welcome this opportunity. I look forward to building, bonding, and working with you to really transform our community.
Again, I want to thank our legislative panel so much for the transparency and the authenticity throughout the entire response and question process. But that is time, and I'm going to kick it back over to our esteemed CEO, Jada Sherrill, to close us out. Thank you.
Thank you, Bernasia. Thank you, everyone, for hanging in there with us for an extra 10 minutes. It was well worth it. I think this was the best 2 hours of my week. We have addressed this issue from multiple angles and multiple perspectives. And I think we probably could still carry on this conversation for hours and hours more. But thank you to our planners. This was awesome. This was a great conversation. It was a much needed conversation. To our hosts, to our panelists, our special guests, and of course, our viewing audience. A couple things I want to highlight as a call to action before we disconnect. The first is to continue to do this important work. For those of us working in community, whether it's with parents, whether it's on behalf of the community as a whole, as elected officials, and those of us who are behind the scenes as administrators, our work is equally important. Those working in the space of government, setting policies, continue to do and support this work, but also take care of yourselves. So just want to uplift Dr. Smith's recommendation that we cannot pour from what we don't have. Also hold your elected officials accountable. Pay attention to what they're doing. Speak out and speak up. And if that feels intimidating at an individual level, there are so many organizations in our community that focus on advocacy and political advocacy in the spaces of, you know, housing, childcare, food insecurity. So make connections with those organizations that are also doing that advocacy work so you can learn more about it and so that you can be part of a group that's galvanizing around moving on some of these issues. You have the right to provide input and feedback. I want to quickly highlight several events that Healthy Start has coming up in conjunction with community. April 11th through the 17th is Black Maternal Health Week. We celebrate and highlight Black Maternal Health Week every year. And this year, we really want to elevate things that are being done in community and important work that's being done across the state. So you will see a campaign on our social media to raise awareness around our Pennsylvania Black Maternal Health Caucus. So shout out to the caucus. They were already mentioned earlier on the call, but we want to make sure that you all know about the important work that the Black Maternal Health Caucus is doing. There will also be other events. We're hosting a baby shower with State Rep Mays on April 13th at the Mount Eric Community Activity Center. There will be lots of information, resources, and opportunities there. May 30th and 31st is our education symposium. We've not done that symposium in a couple years because of the pandemic, and we're excited to come back to that learning format. It will be at the Wyndham in Oakland, and June 1st will be our Black Birth Expo at the ACH Clear Pathways Kauffman Auditorium. You can find more information on all of these events by following our social media, and also the information will be posted to our website very soon. Lastly, make sure you are signed up for our newsletter. You can go to our website and get the link to sign up for our newsletter for real-time monthly updates on what we're doing. And then finally, we have diapers to give away. Thankfully, the Western Pennsylvania Diaper Bank received a federal grant as part of a diaper distribution demonstration grant. We want to make sure that families, diapers are expensive, and we don't want diapers to be a luxury for families and for babies. So we have some extra diapers to give away. If you're part of a community organization, or you know one that can distribute volumes of diapers to families that need them, and particularly in our communities, please give our office a call at 412-247-4009. And again, thank you for your attentiveness today. Thank you for your questions in the chat. And I want everyone to have a wonderful weekend. Thank you.